How can you tell the difference between autism spectrum disorder, ASD, and attention deficit hyperactivity disorder, ADHD? That's what I'm talking about today. I'm Dr. Tracy Marks, a psychiatrist, and I make mental health education videos. Today's question is based on several viewer questions asking me to talk about this. ADHD and autism are neurodevelopmental disorders. Neurodevelopmental means that they start early in childhood and affect how your brain grows and functions. Examples of neurodevelopmental disorders include ADHD, autism spectrum disorder or ASD, intellectual developmental disorder, and learning disorders. It is common if you have one to have another one. In fact, there's a high prevalence of people with autism spectrum who also have ADHD. The reverse is not as common for people with ADHD to also have ASD, but people with ADHD can have features of autism spectrum without having the complete disorder. Both disorders are highly genetic, meaning the genes from them are passed down through families. Before comparing the two disorders, let's look at autism spectrum disorder. ASD is a spectrum disorder because there are many features of it. The features can be grouped into two categories: problems with social communication and relating to others, and restricted repetitive patterns of behaviors, interests, or activities. This is the category that includes being hyper or hyporeactive to sensory experiences. Here's another way of looking at the symptoms on a spectrum. Going from left to right, you have language, which is social communication skills such as body language, eye contact, and small talk, just to name a few skills. Then there is social awareness, which is the ability to read the room, pick up and follow social norms, like saying hello to someone who walks up to you. Next is narrow interest. This is the tendency to narrowly and intensely focus on a niche interest and have trouble shifting tasks or activities. Information processing is the ability to learn new information and apply it to different situations. Sensory processing is a person's response to sensory input like sounds, smells, tastes, and textures. Some people can be hyperreactive to certain sensory inputs and hyporeactive to others. Repetitive behaviors is a tendency to stim in response to different emotions. Stimming refers to self-stimulation behaviors like hand flapping, rocking, or blinking. The last column is neuromotor, which refers to the ability to control your motor movements. And this can range from being clumsy to having little control over intentional movements, including bowel and bladder control. A person can have a range of different functioning in all of these categories, such that some categories may not be as affected as much as others. So in each of these areas, the person with autism spectrum disorder has something going on that is divergent from what is considered standard. If you think of these columns as a slot machine, you pull the handle and it turns each column to a different level of function. So each pull of the handle can turn up a different presentation of the disorder, which is why everyone with ASD is unique. For example, let's look at the language column. One person may not be verbal at all, but is able to pick up on social cues, whereas another person can communicate, but tends to miss social cues and interrupt people when they're talking. A third person may also be verbal and communicative, but has trouble interpreting sarcasm and metaphors. For that person, for optimal communication, they need you to be clear and use direct words. There's a lot of overlap between ASD and ADHD. The person who only has ADHD may have a few of these features, but not all. The person with ASD will have a functional change in all of the areas to some degree, and they may or may not have problems with attention, impulsivity, and hyperactivity, which are problems that come along with ADHD. Let's look at some of the overlapping symptoms between ADHD and ASD. And this analysis is not all-inclusive, as this is a very big topic with a lot of subtleties. So to keep it simple, I'll be covering the major areas. People with ADHD and ASD both have executive dysfunction, like being oblivious to time, emotional dysregulation and trouble getting things started. Both people with ADHD and ASD also have trouble picking up on social cues, but for different reasons. The ADHD person may miss social cues because of trouble paying attention to the entire conversation or hijacking the conversation topic by interrupting and going off on a tangent. On the other hand, the person with ASD may have social interaction problems because they don't understand the subtext messages from body language, or they may get overwhelmed with the sensory demands of chit-chatting. Also, if the person thinks very literally, they may miss important social signals or subtle messages. So you can see the difference in the reasoning behind the problems, even though the end result is similar. Self-stimulation is another overlapping trait that anyone can use to reduce anxiety or to help with focus, but it's used more consistently in people with ASD. Sometimes people can mistake stimming behavior for hyperactivity, like shaking your legs or feet under a desk or fidgeting. The difference comes from the reason behind the activity. The person with ADHD may fidget to help them focus, even though it may be also calming and soothing. The person with ASD, if asked, will usually tell you that something in the environment is making them uncomfortable and they need to fidget to feel better. Or the behavior can be so automatic that they can't always tell you that there's something bothering them. They just need to do the behavior. Also with ASD, it's usually not random fidgeting, like clicking a pen top or doodling. It tends to be more intense with a repetitive pattern, like rocking. A difference between ADHD and ASD is with ADHD, you seek out novel and new experiences, and you can become bored with routine. But with ASD, you're comforted by familiarity and routine. Both of these disorders show some signs in childhood because of how they affect brain development, but both disorders may not be diagnosed until adulthood, especially if your symptoms were manageable for you to get by without professional help. If you have the inattentive form of ADHD without hyperactivity, you may not come to the attention of teachers because you don't pose discipline problems, but you may be underperforming with C's and D's, just enough to pass your classes. And sadly, no one questions if you are capable of more because maybe they've put you in the lazy, poor effort category and just let you flounder. It's not until you have more serious problems like keeping up with work or feeling emotionally unstable that you seek professional help. I talk about some of the ways that ADHD can look different in adults in this video.
Clarence new
For autism spectrum, the symptoms appear when children aren't meeting their developmental milestones, like they're still wearing a diaper in first grade, or have social communication problems, or intense meltdowns from sensory overload. These children will usually come to the attention of a pediatrician or maybe a child therapist to be evaluated and diagnosed early. But without obvious problematic behaviors, you may go undetected or undiagnosed until adulthood with ASD. One of the problems with getting diagnosed is the variability in the presentations, and doctors aren't trained as well to notice the subtle signs. Also, standard medicine focuses more on pathology than wellness. So even if your doctor notices that you have a different speech pattern and you obsess about things and need to self-soothe in response to certain sounds, all things suggesting ASD, your doctor still may not intervene unless these behaviors are causing problems for you, like keeping up with the job or forming relationships. Another way ASD can go unaddressed is if you have one of the common comorbid disorders that can accompany ASD, like social anxiety, depression, OCD, or even complex trauma. If you do struggle with any of these, chances are your doctor will treat you for those problems and not screen you for ASD. I don't recommend trying to diagnose yourself based on learning things on the internet. However, if you are curious if you may have some autism spectrum traits that someone missed, I'll have some online screening tools listed in the description, and they're freely available. If you score high on any of the tools and your symptoms or manifestations are causing problems for you in your work, school, relationships, or with your ability to feel mentally well, then you should see a professional, preferably a therapist.